What if you could be part of a revolution that transforms healthcare as we know it? Welcome to Digital Health Portugal, where innovation meets collaboration. Our mission is to foster the transformation of healthcare systems by promoting open dialogue, civic engagement, and the adoption of innovative technologies. Imagine a world where patient outcomes are optimized and healthcare delivery is seamless. Our Digital Health Manifesto is the strategic framework guiding this transformation. Our events, seminars, and workshops create momentum for sharing and discussing health-related ideas. Experience the power of collaboration at our quarterly meetups. Portugal's thriving startup ecosystem is reshaping the digital health industry. Our products and services are uniquely created to match your communication goals. We are the most relevant civic engagement platform for health innovators. We partner with Forum Hospital do Futuro to foster a sustainable national health service. Our think tank, SNS de Contas Certas, is committed to driving the transformation of the National Health Service through open dialogue among public, private, and social sector stakeholders. We encourage knowledge generation and support policymakers in understanding health ecosystem needs. Be part of the movement, advocate for change, and co-create the future of healthcare. Our members are united by a shared purpose to drive meaningful innovation and transformation in healthcare for the benefit of all. Dive into our podcast to uncover actionable strategies from our think tank plenaries. Join our LinkedIn Live sessions for engaging discussions with healthcare leaders and innovators. Join us at the Health Data Forum Global Hybrid Summit to shape the future of health data. Our goal is to raise the excellence of the Portuguese healthcare ecosystem internationally. Be part of the digital health revolution with Digital Health Portugal and make your mark.
My name is Paul Nunes Dia. This is my English author name for Paulo Nunes de Abreu. It's a little bit more complicated to spell in English. I'm a certified professional facilitator from the IF, and I am the co-founder of the Digital Health Portugal civic platform and also of the Health Data Forum. So it's a great pleasure to be here with all of you. I'd like to welcome all the guests, CEOs, founders, and friends that are joining us today for this CEO and Founders Online Breakfast from Digital Health Portugal. With me from the team, I have here also Sophia Roque. Sophia, maybe you'd like to briefly introduce yourself?
Good morning all. So my name is Sophia Roque. I'm executive coordinator for the team here, both in Digital Health Portugal and Health Data Forum as well. I am a certified nurse. I worked as a nurse for about 12 years, and then I was a nurse manager for 3 years, and then I quit the clinical practice and joined the more of a managing side only. So I've been working with Paul and Pedro for about 2 years now, and it's a pleasure to welcome all of you to this session. Thank you.
Amazing. Thank you so much, Sophia. And we are pleased to have here a group of the most distinguished CEOs and founders right now in Portugal and a little bit all over the world, because we have here also an international participation, as you probably have the chance already to meet and talk to each other. But as promised, I'm going now to, as we have more people in the room, I'm going to do now another breakout session for introductions, right? So you will be able to talk to the neighbor. This is what we want to accomplish with our online CEO and Founders Breakfast. So you meet your neighbors. So I'm going to create another breakout room. Please join the rooms, as it's going to be the way to talk to your neighbor. These breakouts are going to last for 3 minutes only, so you have the chance to know where you're coming from and who you're talking to in the breakout rooms. And then we will be back here in the main room for starting a large group conversation with our guest speaker today, Bonnie Clipper, whom I'm going to introduce to you in a minute. Is that okay, everybody? Okay,
Yes.
so
Perfect.
let's go to the breakouts and have a conversation with your neighbor as we would in a normal cafe table. 3 minutes and we'll be back here. Welcome back, everybody. Don't worry, we are going to have more time on discussions, group discussions. The breakout rooms are going to be used again throughout this session. So stay comfortable and enjoy this part of the conversation, as we are going to start with a small welcome note from Bonnie Clipper. We are so pleased and proud to have Bonnie as the chair of our advisory board here at Digital Health Portugal. Dr. Clipper is a nurse futurist, pioneer in virtual nursing, and nationally recognized thought leader in building cultures of innovation, and also a global speaker in digital health. She brings decades of executive leadership operations and knowledge of technology together to transform the healthcare ecosystems. She was the first VP of innovation of the ANA, the American Nurse Association, where she built the innovation framework to bring other 4 million nurses into the innovation space through education, IMSS, nurse pitch events, and strategic partnerships, such as ANA BD Innovation Awards at the same association, American Nursing Association. So Bonnie has an extensive career, lots of experiences to share. So I'm so pleased to have Bonnie here with us, and kindly ask her to share some notes on how with Digital Health Portugal ecosystem benefit from the experience that you can bring from the other side of the Atlantic, Bonnie. If that's not too much of a challenge for you.
Yeah, no, bom dia. Thank you, everyone. I am in Portugal right now, and I'm learning Portuguese. So this week I have learned to say, fale comigo en português, por favor. But right now I'm going to speak in English. Thank you very, very much, Paulo. It's always so wonderful to be here to learn from all of you what you are doing in Portugal. It's fascinating to me because it is such a uncertain and upside down world right now. So I think it's a really good time for innovation and digital health to jump forward because it's out of necessity. So some of the things that we're seeing in the US from a health perspective that we're trying to be very thoughtful of is that the workforce challenge is only continuing to get worse. There doesn't look like there's a time in the next 10 to 20 years that our workforce improves. So for us, what we're starting to see is many organizations really starting to understand that help is not coming, not in terms of people. So that means that we really are being forced to identify how do we adopt technology and tech platforms that actually will help us shape what healthcare looks like, how it's delivered, how we measure it, how we can make it more efficient. So I think it's an interesting time, yet it's going to be a good time for innovation. As we begin to think about technology adoption, I think we probably, a day doesn't go by that we don't hear about AI. So we all know that AI is going to continue to expand in our lives and in our healthcare. And I think we're all trying to figure out what that means. In the United States, there's a lot of tension with the adoption of artificial intelligence in healthcare. And some of that is because there's such a lack of trust as what AI is going to be able to do or do with our data. For example, I was reading an article yesterday, and there's now over 1,000 unions in the United States that have joined together, and they're starting to develop an AI compact. And they want rules around what AI is going to be used for, and that people need to be notified of this in advance. And as I was reading this, one of the things that jumped out at me that was a little bit creepy was that Walmart is looking at utilizing an AI platform that's cameras located throughout their stores, and it's scanning for shoppers that look unhappy or confused, and it wants to identify them. There's a part of me that thinks that's fascinating, and there's a part of me that thinks that's really creepy. So when we start to think about AI adoption, I think we have to really find ways to build trust and help our patients and our communities understand what we're doing with it, because there's so much good that can come from this. We know that we can use artificial intelligence to help us become more efficient, to help us with research, to help us analyze data, analyze research articles. So there's a tremendous amount of good that comes from this. We really have to work very, very hard to build trust. I think that we are also going to see, certainly in the United States, the adoption of more technology to enable care. Now, I don't know what that looks like in Portugal or in Europe, because it's a little bit different in terms of funding sources. Where does the money come from to support some of that infrastructure? So I think that this is going to be very interesting for both sides of the Atlantic to see, what do we do with these investments? How long do the investments take? And what's the outcome of that? My sense when I talk to CEOs in the United States is that there's very little interest to spend any money right now that does not have a very strong return on investment. And there's a lot of worry. We've spent billions and billions of dollars in the US on the electronic health record. I think no one wants to repeat that, because it feels as though it hasn't always made us more efficient or improved health the way we thought it would. So I think that there's a lot of opportunity. There's a lot of optimism. We're also trying to be very mindful about what we do. So I just wanted to give you a little sense of what's going on, Paul. So if there's any questions or anything else that I think you would find helpful, I'm certainly happy to entertain those questions.
Thank you so much, Bonnie, for this opening. And in order to have to generate some questions for Bonnie, right? So what I'm going to do, I'm going to create breakout sessions. So Bonnie, please don't go to the breakouts this time. Stay with me here. Going to breakout sections for 2-3 minutes, so you can have a reflection on what just Bonnie said. And perhaps you can come up with a question that we then will be sharing with Bonnie. Would that be okay for everybody? Okay, so let's now open the breakout rooms again. I'm going to recreate them in order to you to have the chance to speak with someone else that you don't met. Don't spend too much time in the introductions. Go directly to the reflection on what Bonnie just said, and perhaps think about a question you like to ask that will be answered in this large group. I'm going to keep the groups for 3 minutes only, okay? So enjoy. And Bonnie, please stay with me here as I'm going to interview you here while participants are. Great, great. Bonnie, so it's great to have you here with us, and thank you so much for this opening presentation. And while the participants are also thinking about the questions they're going to ask, let me just ask you a question. Is that okay?
Yes, of course.
So from what you just said, and given the knowledge you have already of Portugal, how do you think what could be done in order for Portugal to have a more efficient digital health ecosystem in your perspective?
Yeah, I think that's a really great question, Paulo. I think first it's a matter of identifying which problem you're trying to solve. Is it that you're trying to solve for a shortage of nurses? Are you trying to solve for a shortage of doctors? I know I have been reading a lot about babies, right? The ability to deliver babies in obstetrics, and some hospitals in Portugal literally closed down their ability to deliver babies. So, what happens in those communities to pregnant people? I think that when you look at technology, there's certainly no shortage of problems to solve. How can we better solve them? Is it a matter of better scheduling of doctors that deliver babies and finding a way to move them around the country so that they can help provide that kind of care? Is it scheduling deliveries differently? I'm not sure. But I think that there's an opportunity to start to explore how technology might be able to help with some of those problems.
Oh, that's great. That's great. I was interviewing a deputy from the regional parliament of Catalonia, Carlos Campuzano, just the other day. Is also the former regional minister of healthcare in Catalonia, and we talked about the fact that technology might be a replacer on these certain kinds of social health and care functions that are pretty scarce right now in terms of human resources availability. How do you see that technology could be doing work that is currently made by humans that are currently simply not available to be hired?
Yeah, that's a really good question. So when we look at technology adoption, there's a framework to think about, and it's very similar to Maslow's hierarchy framework. So think about how you can use technology today to offload repetitive tasks that humans do throughout the day that repeat over and over. So for example, you don't need to use human beings to collect money anymore. You don't need to use human beings to send a bill anymore. You don't need to use human beings to properly code a chart to make sure that the doctor is collecting money or the hospital is collecting money. Those can all be automated. However, we absolutely want to protect the human being, so we can use them for interactions with patients. They will always be the connection between a patient and touching and assessing and talking to a patient. That's got to be work that we say for the humans. So we need to look for opportunities to offload all of the other lower level repetitive tasks.
That's awesome, Bonnie. Thank you so much. Now let's close the breakout rooms. Let's bring everybody to the room, and let's see if we have more interesting questions to address here, not just obviously by you, Bonnie, but as a collective, as a group. We might be reaching out some conclusions here on this online breakfast. So let's wait for participants to come back and enjoy our time together here, and hopefully end this online breakfast with some conclusions that our viewers, our followers could take back home, wherever they work, building a better and more resilient digital health ecosystem in Portugal. I'm not saying, okay, everybody, welcome back. And let's now hear from all of you in terms of comments, questions, reflections that you may have brought from the discussions in the breakouts. Anyone would like to, oh, I see Tamara already willing to share.
Before I forget the question. So
go ahead, Tamara. The floor is all yours, and please raise your hands if you want to intervene. Now it's going to be the large group discussion for the next 10 minutes.
Yeah, so I want to thank Bonnie for her excellent exposure of her point of view, and I would like to ask her opinion regarding bottom-up initiatives that are based on real needs identified by affected people, because we need to be financed by the state, by the government, but how can we convince the government to support this kind of initiatives that are clearly citizen-to-citizen initiatives done by people that know their real needs, that identified their real needs during the years of activity. And yeah, how can we convince government to support this kind of bottom-up initiatives?
Tamara, that's a great question. So in my opinion, based on literally what we've seen happen in just the first 2 months of this year, I think that globally we're going to begin to see a lot of sort of protection from an economic perspective of funds, of revenues, of things of that nature. The way that I'm reading the tea leaves is that I think it is probably going to be a challenging year or two from a funding perspective in healthcare, among other industries. So what I see that meaning is that any initiatives that are funded really have to have a strong business case associated with them in order for governments to truly get behind that work and move forward. And I think that's particularly true in light of even geopolitically what we've seen here in the last 2 weeks. So we're certainly feeling this in the United States, that where innovation is heading is really now all about the return on investment to truly solve a problem for large groups of people. I think that's, again, in my opinion, smaller or more niche topics that, even though they're important, I think if they don't have a truly strong business case, I think things like that are probably going to be put on hold for a year or two or three, depending on kind of how we all learn to work through things.
Yeah, that's amazing. Thank you so much. And before we have another question, let me, and this is hopefully, I hope you don't mind, Cherise. Let me put in the spotlight here Cherise Spark. She's also here with us, medical doctor and CEO of different organizations, and also Chief Medical Officer in Applied VR's digital therapeutics company. But she's also advisory board member on our advisory board member here at Health Forum and Digital Health Portugal, and also on Diversity by Doing, and also Chief Medical Officer in Inspire Medical Systems. But maybe, Cherise, you can talk a little bit more about yourself, and also to share some perspectives on this great question by Tamara.
Yeah. Good morning, good afternoon, good evening, wherever you are. I am very early in the morning in the United States, but I'm really pleased. Yeah, I'm very pleased to be here. And I am by training an orthopedic trauma surgeon. And the other interesting fact about me is the process by which we're talking today, the application of AI, and what does that mean, and how does that affect us is very pertinent to all the other activities that I'm involved in right now, from virtual reality to the fields of delivering direct-to-consumer marketing efforts to deliver product to customers in the space of sleep apnea. And so those are the two areas that I am closest and involved with. But we have to think about what Bonnie said is really interesting to me, because I like to go even deeper to Tamara's point, is how do we get the grassroots level excited, or how do we impact on a patient level? And to me, that's the whole one of the more critical issues about how do we adopt AI into everyday practice in delivering the healthcare that we know is available and we know we have the ability to deliver, but getting it delivered to the right people in the right way at the right time. And to me, fundamentally, if we don't begin to reach out to every demographic, to every patient who could be affected, those that are disadvantaged or those that are advantaged, and to begin to inform the algorithms. So it's all, to me, the biggest fear for me is the training of the algorithms. Who is providing the data that helps these tools make decisions? And if we're not able to impact or have a voice from everyone who could be impacted from these kinds of tools, how effective are they really? And then we talk, when we talk about access, so to Tamara's point, I'm really interested in how others feel about how do we become activists, because that is what we need to do, is we need to activate government to understand that we, the people, we are those that need to be in service or to be serviced. And if they don't ask us, and if they don't grant opportunity to entree or enter this market or enter the delivery of foundational information, what kind of tool will it really be, and what kind of service will it really provide?
Mm-hmm. Thank you so much, Cherise. And obviously, I have here more people in the large group. I also understand that the fact that we are speaking in English might block a little bit our participation. So that's the reason why I'm going to create the breakout rooms again for more reflections and sharing. I'm going also to create a shared document, so you please can use whatever language you like, English or Portuguese, because AI then will help us to drawing some conclusions. I'll be do that in a minute. But now let me put here in the spotlight perhaps a new member at the Digital Health community, and I'm sure you'll be getting along well in English. Benjamin, welcome to Digital Health Portugal CEO Online Breakfast. Would you be so kind to introduce yourself to the community and also share some thoughts about what you like to do about this incredible discussion so far?
For sure. And again, thank you so much for the invitation, Paul. So my name is Benjamin. I've had the pleasure to meet a few of you right now in the breakout session. So I have been working within digital health and health tech for the last 12 years. I am Danish by origin, moved to the beautiful country of Portugal and to Lisbon about 3 years ago. So my wife is Portuguese and we're expecting our first kid here in the end of May. So we will we'll definitely be sticking around for many more years. I'm very happy about that. So I have been lucky enough to be working within health tech for about 12 years. As I mentioned, I have been working kind of on the forefront of innovation, been building my own startups in the space, and basically been looking at how can we utilize, also to Cherise and Bonnie's point, how can we actually utilize technology in a meaningful way in the healthcare systems. I've also been part of both big pharma and medtech, so I've also seen it from that side as well, because that's not a, that's also a big player in all of this. Today I serve as the CEO and founder of a company working within osteoporosis or bone health and women's health, where we're building the first virtual clinic within osteoporosis, which we are launching and have launched in Denmark, and are now launching in the US as well. So also getting a few perspectives on this side in Europe, but also on the other side of the Atlantic, which is very interesting. In the breakout session, I was speaking with Therese as well a little bit about this, and I very much echo, and I've seen that I think AI is really fueling the whole discussion about the demographic divide that we have in the society today, and how we can also utilize technology in order to serve people that is in most need, because ultimately that is, I think, one of the key questions that we sometimes forget to answer when we're talking about technology. It's very much serving for those that have the resources available. Those are the early adopters. Those are the ones that is also kind of building the technology in, I would say, 95% of the cases. But how, and maybe a provocative question is, should we also build technology for those that are, that actually have the biggest healthcare need, or should we allocate more resources to that group to support them, in order to actually serve this group of patients? I think, because I've at least seen that technology has not really been living up to its promise, and I think that's also why we see a big discourse in these discussions, and also why we see a lot of pushback from the healthcare system saying actually adopting this is because we don't see the necessary outcomes. And I think that is really a discussion where, again, AI, I think, can be fueling this to an even larger degree, because it's going so fast, the technology, and it's so powerful. But how do we actually get it into the hands of those that need it the most? And to Therese's point, how do we also build technologies that really make an effect for this group of patients? And I think, going back to also Tamara's point, I think we need much more grassroots initiatives that is also being funded, and maybe also being a little bit realistic about how much technology can actually move the needle for this group in the short term. So I think a few reflections from my side, and I think also, again, for us to be a little bit realistic about how much this can actually also, how much technology can actually help in the healthcare sector in the short term.
Okay, that's amazing, Benjamin. Thank you so much. Here for Portuguese, switching to Portuguese now, if that's possible. Paulo Gonçalves, Rui Teixeira, e vamos passar agora para o português, se pudermos fazer aqui uma pequena gravação em que podemos fazer aqui também uma pequena conversação. E talvez a Ana também está aqui connosco, vamos pôr aqui a Ana no spotlight também. Ou não sei que a Ana pretenda ir para o grupo inglês. Ana, queres ir para o grupo inglês?
It's up to you.
Ou ficas aqui no português? É que a Ana tem agora em mãos também um evento internacional.
Se calhar vou para o inglês. Sorry.
Ok, então vamos pôr aqui a Vânia. Vânia, aqui para o spotlight em português. E se calhar aqui também algum mais voluntário. Francisco Velez Roxo, vou pegar em si também aqui para o spotlight, pode ser? Passar para um painel português. Okay. Meus amigos, obrigada por estarem aqui conosco nesta online CEO and Founders Breakfast, nesta parte da nossa sessão esta manhã em português, aqui com estes convidados. Como é que podemos fortalecer o sistema da saúde digital em Portugal? Era esta a questão que lançava aqui para a nossa manhã, nestes próximos 10 minutos. Alguém tem ideias?
Posso só lançar uma pequena provocação da notícia do meu café da manhã hoje. Os 1.500 milhões de euros para o déficit dos nossos hospitais. Ou seja, qual é o impacto na cabeça dos administradores hospitalares, dos decision makers, não é? Para a abertura para a inovação, quando há aqui um problema de base, não é? De subfinanciamento dos hospitais. Atenção, é provocação, que eu acho que esta é uma pergunta quase retórica, tá bem? Mas é para lançar que há aqui vários ângulos que se podem pegar relativamente à abertura das entidades para a inovação. Naturalmente, o dinheiro é mais uma. entenda-se, é importante, sim senhor, mas é mais uma. Eu lanço esta pequena provocação porque foi a notícia que eu li hoje de manhã, assim, ao pequeno almoço, no primeiro pequeno almoço, e deixo à discussão.
É uma excelente pergunta. Quase que adivinho quem vai responder.
Exato, eu não iria responder à provocação porque acho que temos alguém aqui que está mais apto para tal.
Bem, deixa-me dizer-vos que eu, quando leio headlines sobre o dinheiro, fico sempre com aquela sensação de que lá vem mais uma daquelas provocações jornalísticas para esconder o problema. O problema não é dinheiro, não é dinheiro, nunca foi dinheiro. O problema é, às vezes, é dinheiro a mais. O problema de tudo quanto tem que ver com a alteração da saúde, o ecossistema, com base mais tecnológica do que tem sido, porque é bastante, e não vale a pena estarmos com ilusões. Agora, com a inteligência artificial é que parece que tudo vai mudar de um momento para o outro, ainda que vai mudar bastante. Portanto, o que está em causa, e há pouco referi isso no primeiro breakdown que fizemos, é que dados há aos pontapés, mas não tão limpos. E na saúde, tanto no SNS serviço, como no SNS sistema, as coisas são bastante complicadas. E depois há os processos de trabalho, que é um tema de 25 anos, 30 anos, que não se alteraram significativamente. O ponto que me parece mais crítico neste momento para alterar o ecossistema tem que ver com a literacia em Health Systems, em Digital Health Systems, que enferma a maior parte das classes profissionais, médicos, enfermeiros, farmacêuticos, etc., mas também a nível daquilo que é em Portugal bastante importante, que é o ecossistema das autarquias do poder local e da capacidade junto das IPSS e, enfim, até da própria comunidade científica ou escolar, de poder integrar holisticamente uma visão de futuro. Do ponto de vista de dinheiro, e como o Rui acabou de referir, é claro, o problema é efetivamente sempre ótimo para dar um grande headline e o Serviço Nacional de Saúde já vai com 18 mil milhões de investimentos, quando há 10 anos era de 8 mil milhões, e o problema continua a colocar-se. Portanto, não é um problema de dinheiro, é um problema, sobretudo, de má gestão das formas como os fluxos financeiros e económicos vão circulando. E neste momento, eu não vejo liderança capaz a nível global, tanto pública como privada, ainda que os privados façam o seu percurso sempre normal no âmbito do SNS, sistema, e as coisas vão caminhando. Agora, em termos de saúde global, população em geral, o ecossistema precisa de ajustamentos que passam por muito mais de conhecimento do que propriamente de investimento, ainda que o investimento seja crítico. Há decisões relativamente à articulação entre os dados do público e do privado que têm vindo a ser discutido, mas eu vou sempre esbarrar no velho tema do Regulamento Geral da Proteção de Dados, e agora com a inteligência artificial há uma incógnita ainda maior sobre a qual eu tenho dúvidas de que a curto prazo seja possível resolver, para além de grandes parangonas de jornais e de até muitas vezes comunicações político-partidárias. Em resumo, penso que neste momento há uma necessidade de alterar profundamente o ecossistema, não apenas na dimensão saúde, mas na dimensão também de caráter político ou local, como é o caso das autarquias e das IPSS, e ao mesmo tempo dos players tecnológicos, que em Portugal há bastantes, e com muita capacidade para poder intervir, como é o caso da Glint desde há muito tempo, tem acontecido na articulação com as farmácias, etc. Portanto, estamos perante um grande molho de brócolis e um grande imbróglio.
É um grande imbróglio. Eu agradeço imenso este kick-off, Rui, e esta excelente resposta do Francisco Leis Roos. Foi de facto, era a pessoa que eu esperava que pudesse dar aqui uma resposta. E lembrar a todos os que nos seguem e que nos ouvem que vai haver o quarto plenário do Think Tank SNS de Contas Certas, vai decorrer no próximo mês de abril, na Fundação Carlos Gulbenkian. Temos o prazer de ter também lá já connosco o professor Francisco Leis Roos, que está aqui connosco hoje e que também vai participar nesse plenário, e precisamente aí estas questões, esta repensar da articulação nacional-local, pode estar aí uma das chaves de tornarmos um SNS mais sustentável e de conseguirmos, como o Rui aqui bem referiu, a tranquilidade financeira para que a inovação possa ocorrer. E, portanto, este aspecto é, de facto, importante. À parte isto, como é que podemos fortalecer mais o ecossistema da saúde digital em Portugal? Eu agora gostava de ouvir aqui alguma voz feminina. Vânia, Sofia,
Sim.
Tamara, e o Paulo também, se quiser, pode intervir, faz favor, que ainda não interveio.
Eu posso falar. Aqui, no seguimento daquilo que o professor Francisco Feliz Rocha estava a falar, de facto, a parte das autarquias é muito importante, mas acho que antes disso há uma coisa que é, nós já estamos a lidar com muita tecnologia e primeiro precisamos de quebrar preconceitos que nós temos todos, principalmente quando dizemos que a tecnologia para os mais velhos não funciona, não sei o quê. Não é verdade, nós temos pessoas a ser já seguidas a nível, em casa, através do hospital, com sistemas digitais, não é isso que está em causa, nós temos muitos preconceitos que não nos permitem avançar ou que nos limitam no nosso avanço. Portanto, primeiro é quebrar esses preconceitos. Depois, diria que é fazer, que é algo que nós em Portugal temos alguma dificuldade, que é, nós temos muitas ideias, nós dizemos todos que devemos, queremos, temos, mas depois demora muito a sair do papel. É verdade que por uma questão regulatória, nós somos na Europa altamente regulados, é um facto, mas se nós não tivermos a capacidade de fazer, implementar, experimentar, voltar para trás, fazer, implementar, experimentar, e se não estivermos dispostos a fazer isso, então daqui a 20 anos vamos continuar aqui nesta mesma sala a dizer como é que conceitos colocar em prática aquilo que nós pretendemos, e obviamente aproveitar aquilo que está a acontecer e puxando para aqui aquilo que é a inteligência artificial, diria que ela nem é, no meu ponto de vista, nem é um papão que nos vem tirar o nosso trabalho a todos, também não é a salvação. Ou seja, será algo que nós temos que saber interpretar, surfar a onda e perceber o que é que fará sentido no futuro utilizar. Portanto, se eu tivesse que colocar em 3 pontos, era preconceitos, colocar em prática, fazer processos, também de todo acordo, e depois aproveitar a onda e surfar a onda da inteligência artificial.
Sem dúvida, Vânia Serra, muito obrigada pela esta contribuição que dá aqui ao nosso painel em língua portuguesa. Eu gostava de ouvir mais opiniões, mais contributos. Como é que podemos fortalecer o ecossistema da saúde digital em Portugal?
Nós precisamos de educar a sociedade portuguesa. Se nós não educarmos a sociedade portuguesa, vamos continuar a dizer que as pessoas de 80 anos não conseguem não sei o quê, e que as crianças só passam a vida a ver jogos e a jogar e a não se concentrarem. Nós precisamos de educar a sociedade portuguesa para em primeiro lugar, para uma exigência de compromisso sobre a estratégia. Isto é, nós temos um governo, qualquer que seja, entra e quer ter resultados em 3 meses. E depois as pessoas estão sempre à espera do próximo telejornal, a próxima página de abertura de telejornal, a próxima headline do... E depois a seguir temos, por exemplo, muito, muito simples. Nós temos uma ministra que quando entrou, a primeira coisa que ela queria fazer era alterar as ULS e dividir as ULS entre universitários, quando nós ainda não tínhamos 3 meses do ULS. E eu conheço-a bem, eu estou a dizer isto com toda a vontade, já o disse pessoalmente. O que nós precisamos é de educar as pessoas para termos uma estratégia de saúde a 10 anos. Estive a semana passada no Algarve, no Dia Mundial das Doenças Raras, e nós lançamos no dia 28 o plano para as doenças raras. E eu participei num dos painéis e depois fiz o encerramento, e uma das coisas que eu senti nas várias perguntas e comentários foi uma tristeza e algumas pessoas, mais do que tristes, estavam zangadas porque Portugal continua a ser Portugal e os Algarves. E porquê que a palavra Algarves tem que ser escalpelizada? Porque dentro dos Algarves, porquê que eles dizem Algarves? Porque são 17 municípios. E nos 17 municípios, eles não falam uns com os outros. Okay? Ou falam 2 ou 3. Porque depois é o Barlavento, é o Sotavento, e depois é o Algarve interior, e é o não sei quê. E aquilo que a única coisa que eu lhes disse foi, realmente, há uns meses atrás, disseram-me que o Algarve não era um problema. E eu não concordo. Eu acho que o Algarve, aliás, na altura disse, eu não concordo. Mas depois, naquela tarde, ouvindo aquilo tudo, eu disse, a pessoa que me disse há 9 meses atrás que o Algarve não era um problema, eu acho que ele tinha razão. Porque o que nós temos aqui não é um problema, é uma oportunidade de demonstrar que o Governo Central em Lisboa estão errados. Não é? E vamos pegar neste plano e demonstrar que o Algarve não são Algarves, mas que é o exemplo a dar ao país de união e de trabalho conjunto. Vocês não imaginam como houve uma mudança de semblante. O que é que eu quero dizer com isto? É que se nós todos quisermos criticar os headlines dos jornais ou as páginas dos jornais e as notícias, etc., o que estamos a fazer é contribuir para mais do mesmo. O que nós precisamos de fazer é, primeiro, educar a sociedade, segundo, exigir que haja um cumprimento de estratégia, porque uma das coisas que vai acontecer com este plano, e eu falo enfim, como membro de associações de doentes, de várias associações de doentes e de uma federação, aquilo que nós temos que fazer em relação a este plano é, o plano agora estamos a perguntar à Secretária de Estado, então já está, e agora já está aprovado, e agora já está. Quando depois ficar aprovado, o que temos que fazer é, e agora? Ministério da Segurança Social, já está, este ponto já está, a DGS, isto já está, e agora já está, como as crianças quando vão para... vão de férias com os pais e mal entram no carro já estão a perguntar, então e agora? Já chegamos e falta muito, e já chegamos e falta muito. Se nós não fizermos isto, estamos a contribuir para mais do mesmo.
Excelente, excelente. Eu aplaudo aqui esta intervenção, Paulo Gonçalves, o presidente da RD Portugal, que está aqui connosco e também membro do think tank do 4º plenário SNS de Contas Certas, onde iremos seguramente pegar mais nestas conclusões. E vamos agora dar as boas-vindas a David Magoble e passar para o inglês. Let's switch to English. Hi, David. It's good to see you here.
Hi, everyone.
And direct from the World Mobile
World
Congress.
Congress,
Yes,
indeed.
maybe you can share with us here some
So,
perspective.
so I'm very sorry you just put me on the line to grab a coffee, but let me explain to you a little bit what's going on here at the Mobile World Congress. So thank you very much, Paul, for having me, and sorry for just being able to connect like this, but you know what it's like to be in a fair. So first of all, Mobile World Congress is one of the biggest tech fairs, I would even say, in the world. Definitely the biggest one in Europe. Yes. And it hosts for 100,000 people, attendees here at the. By the way, sorry, can you hear me well?
Yes, we can hear you well. We can hear you fine.
Okay,
yes.
so I'll be walking around and then I'll show you a little bit what's going on. So there's 100,000 attendees normally of Mobile World Congress. It has 8 pavilions, so it's really, really big. And for instance, it's all what the telecoms and tech world companies, they present their latest technologies. So you have, for instance, Huawei, who has just a whole pavilion to themselves. So this is really where they showcase their latest innovations. There's about
do you see any
exhibitors.
David, do you see any Portuguese company there?
Yeah, so at the Portuguese level, we've seen more telecoms. You have NOS, you have MEO / Altice, you have consultancy companies as well. So you have Accenture, KPMG. I'm saying this because I've seen some Portuguese attendees there. And also we have a lot of startups. So just to give you a little bit more detail, so there's 8 pavilions, and only one pavilion, which is the one I'm standing here at the moment, is dedicated to startups. So it's called 4 years from now, and this is where they showcase the latest startups, mainly of, obviously you have international startups, but this is definitely a showcase for the Catalonian region, and to show how Barcelona and its surrounding areas are really focusing on innovation. So you have, I would say, 3 layers of entities exhibiting here. You have, first of all, the regional area. So let me share here behind me. You have Biocat, as you can see. So Biocat, so the Catalonian Healthcare and Life Sciences region, they showcase their solution. You have research institutes such as the Brain Supercomputing Center, also of Barcelona. So the research centers are one of the areas. Universities is another layer also of exhibitors, where you have the tech transfer offices that also showcases their latest spin-offs. And then finally, you have the startups as well. And here in the 4 years from now, one of the biggest areas really and focus areas is healthcare. So in healthcare, what you see here, and this is why last year was my first time here at Mobile World Congress. And so this is my second one. And I thought I really needed to come back, especially because obviously I work with healthcare and healthcare startups, is the fact that really Barcelona is showcasing a lot of their innovations around healthcare. So not just the startups, but even hospitals. You also have entities like TIC Salut who are focusing on the startups they're working with. And one thing that really surprised me last year was to see how many clinicians are coming around here at the fair. And clinicians themselves, I'm talking about psychiatrists, cardiologists, radiologists, etc., who are themselves looking for innovations and technologies for their daily practice. And this is the first time I've seen anything like it, at least in Europe, where you have, again, clinicians and doctors and healthcare professionals who are themselves individually looking for technologies, because this just shows that they know that technology can enhance their performance. And so I thought that was really amazing, and it shows the innovative mindset that you have here around Catalonia above all, but also obviously Spain and at this trade show.
And David, a quick question to you,
yes.
because I know you are busy and you need to visit the trade show. You are eager to visit our Portuguese companies there and the Portuguese.
And you have Startup Portugal here with their own startups.
Okay, yeah, that's what I was asking about, the Startup Portugal and our startups. Are there any specific companies you like to mention here?
So I can mention, I mean, they're not here at the moment, you know, even though they have a stand, but they're walking around and trying to gather customers as well, get to know them. But we have Breast Screen AI, if you can see behind me, it's Breast Screening AI. It's a software that is analyzing for breast cancer regarding MRI and X-ray images.
Yes, we know them. We know them very well. Breast Screening AI. Yeah.
And someone you know for sure, Complear. So Miguel Amador now is talking to some clients here. Okay. So they're here. And basically, those are the only healthcare startups around here coming this year. Last year, I know Uphill, the Portuguese startup, was here as well. And definitely, now all the other ones are, there's Grant AR and some other companies here. But regarding healthcare, it's mainly Complear and Breast Screening.
Fantastic,
AI.
fantastic. Yes, I'm glad that you've. A quick question, David, before we go. If you compare the Web Summit with the Mobile World Congress, are we in Portugal taking the same advantage for the Portuguese ecosystem as you see Catalonia government taking advantage of the Mobile World Congress there? Are we better, worse, same?
I mean, to be fair, that's a very good question. I think you have above all, the difference is Catalonia here is really positioned as an innovative region. So not only they have the companies based here, they have the universities based here, but also they have got their institutions, like right behind me, and they are proud of their own institutions. Right behind me, you have the Catalonian Data Protection Agency. So these, I would say, specialized institutions that all of them work together to for once position themselves in innovation, and for second to promote the Catalonian region. They really work well together, and they are very well orchestrated. And I think maybe that is the big difference, where you have, and again, whereas the Web Summit, you have 70,000 people. Here you have 100,000 people really coming from all over the world as well. And this is really a big B2B show as well. Whereas I would say at Web Summit, you have a lot of startups who are focusing on B2C sales strategies, where here's a lot of B2B. But I think that Barcelona, even though this has become a huge, huge trade show with so many visitors, Barcelona guaranteed that they owned the show. When I'm saying I'm on the show, this is most of all innovation made in Catalonia that we're going to promote, and then we're going to have the other companies also presenting their technology. Whereas in Portugal at Web Summit, it's always been an international fair, and I think in Portugal should do better and more to promote our key industries and also to promote our key institutions. I think we should own Web Summit a little bit more, and it's not just about having a Startup Portugal and a Unicorn Factory Lisbon a stand. It's about promoting more of what is doing around research, having there are universities as well, which is something that you normally don't see at Web Summit, the research they're doing. So we should empower all of the layers of the institutions that are doing innovation in Portugal as well. I think that would be my main takeaway.
Thank you so much, David. And this is going to be an important statement. And I am sure that we, Digital Health Portugal, and along with Lab to Market and other partners, we are going to work hard to make Web Summit different this year for the better. We should. Enjoy the show, David. Enjoy,
right.
And looking forward to see you and catching up when you return.
Perfect. Thank you much. Thank you for having me. Have a good day. Speak to you soon, guys. Bye-bye.
Speak to you, David. Right. So it's really a nice way to wrap up and conclude this breakfast. We are a few minutes ahead of 10 minutes, but I'm sure everybody will appreciate if we can leave earlier, because that's the gift we're going to give you, time. And Sophia, Bonnie, let's wrap up for conclusions, as we need to go and have our busy schedules up to date.
Absolutely. I just really want to thank everyone for coming together this morning and sharing some really great thoughts and insights about what's going on in the digital health ecosystem. I think it's a great time for us to continue to move forward and to find reasons to push our agendas, get our communities involved, get patients involved to really drive the solutions that we all need. Certainly look forward to continuing to work with you both in Portugal and from the other side of the Atlantic as well. So I think there's a lot of really good brain power going on here. We need to find ways to get everything to work and inch forward.
Yeah. Sofia, algumas observações em português para terminarmos?
Bem, eu acho que esta manhã reforçou em tudo aquilo que temos vindo a falar ao longo do último ano, com o nosso Manifesto de Saúde Digital, com as nossas últimas tertúlias também que temos feito. E, efetivamente, a palavra-chave no meio de tudo isto é colaboração e cooperação. Nós necessitamos disso para seguir em frente. É obviamente preciso que se criem as condições para que a tecnologia esteja presente cada vez mais junto dos nossos pacientes e que os possa efetivamente ajudar o nosso sistema de saúde a oferecer melhor qualidade, melhor acesso e melhores resultados em saúde. É aquilo que se pretende, é aquilo para o que nós trabalhamos todos os dias, e é isso que efetivamente queremos que se concretize.
Muito obrigada, Sofia. Thank you so much, everyone. Muito obrigado a todos pela vossa presença. Nós vamos acabar aqui a transmissão, a gravação, mas vou criar 2 breakouts para quem quiser, até esgotar o tempo, possam continuar a conversar. Nós terminamos aqui a nossa gravação e foi de facto um gosto estarmos aqui com todos vós. Atenção, quem está no Zoom e tem tempo e quer partilhar, quer continuar as conversas, eu vou continuar breakouts até que haja a última pessoa que se vai embora, e nessa altura é aí que fecharemos o Zoom. Mas de momento paramos aqui a nossa gravação e a transmissão em direto. Espero que todos os participantes que nos sigam tenham apreciado este momento em conjunto e sigam as nossas iniciativas, sigam as nossas plataformas. Até a uma próxima oportunidade. Um grande bem-aja e bom resto de semana para todos.
Obrigado.
Unlock the secrets of healthcare data innovation and witness the future of patient care unfold. Dive into the Health Data Forum, where groundbreaking advancements and cutting-edge insights await. Explore the transformative power of data to revolutionize healthcare delivery and societal well-being. Join leading experts, thought leaders, and innovators as they delve into the latest trends and challenges. Experience the collaborative spirit of a vibrant community where ideas converge and partnerships flourish. Participate in discussions, share your perspectives, and contribute to shaping a healthier future. Stay ahead of the curve with our comprehensive video library, featuring insightful interviews and presentations. Catch up on thought-provoking conversations and engaging discussions that keep you informed. Together, let's harness the power of data to transform healthcare for the better. Join the Health Data Forum's mission to make healthcare data work for everyone. What if you could be part of a revolution that transforms healthcare as we know it? Welcome to Digital Health Portugal, where innovation meets collaboration. Our mission is to foster the transformation of healthcare systems by promoting open dialogue, civic engagement, and the adoption of innovative technologies. Imagine a world where patient outcomes are optimized and healthcare delivery is seamless. Our Digital Health Manifesto is the strategic framework guiding this transformation. Our events, seminars, and workshops create momentum for sharing and discussing health-related ideas. Experience the power of collaboration at our quarterly meetups. Portugal's thriving startup ecosystem is reshaping the digital health industry. Our products and services are uniquely created to match your communication goals. We are the most relevant civic engagement platform for health innovators. We partner with Forum Hospital do Futuro to foster a sustainable national health service. Our think tank, SNS de Conselhos, is committed to driving the transformation of the national health service through open dialogue among public, private, and social sector stakeholders. We encourage knowledge generation and support policymakers in understanding health ecosystem needs. Be part of the movement, advocate for change, and co-create the future of healthcare. Our members are united by a shared purpose to drive meaningful innovation and transformation in healthcare for the benefit of all. Dive into our podcast to uncover actionable strategies from our think tank plenaries. Join our LinkedIn Live sessions for engaging discussions with healthcare leaders and innovators. Join us at the Health Data Forum Global Hybrid Summit to shape the future of health data. Our goal is to raise the excellence of the Portuguese healthcare ecosystem internationally. Be part of the digital health revolution with Digital Health Portugal and make your mark.